Hi, Marnie.
Hi, good to
Um,
see you.
so Marnie is an expert in restorative tattooing, and she has graciously agreed to join us to give everyone a little primer on this topic and take your questions. We're also going to be joined by Xandra Havasi, who recently had her nipple tattoos. We are working on that one right now. Um, okay. Marnie, if you want to start introducing yourself while
Sure.
I get Xandra on the live, that would be great.
Okay. Hi, everyone. I am Marnie Restemeyer, and I'm the restorative tattoo artist at Nibra Plastic Surgery. I have been tattooing for about 7 years. I'm a member of the American Academy of Micropigmentation and the Society of Permanent Cosmetics. And in addition to restorative tattooing, I also do permanent cosmetics, which includes brows, lips, eyeliner, and scar camouflage.
So, for the purposes of this, we are focusing mostly on the nipple tattooing and the scar camouflage, which I think is like sort of an underappreciated topic. But also I'd like to welcome Xandra, who has just joined.
Hi,
Hi.
everyone. I'm Sandra Havasi. I'm a breast cancer survivor. I was one of Marnie's patients, and I got 3D nipple restoration tattoos. I wasn't a candidate for the nipple reconstruction, so it's just a tattoo.
Okay. All right. So I think it would be nice if we could kick things off. Marnie, can you just walk us through what it's like to get nipple tattoos and what the difference between a 3D tattoo like the one Xandra had is and a tattoo over a nipple reconstruction, like what the difference is there.
Yeah, so there are a lot of different types of plastic surgeries, reconstructive surgeries available to breast cancer survivors. And it depends on the conversation that you have with your surgeon and the type that determines the type of reconstruction that you ultimately have. Some patients have nipple reconstruction and they're a candidate for that, and some aren't. And they're unable to have their nipple reconstruction. So they just have a 3D nipple tattoo. If somebody has had a nipple reconstruction, I tattoo the areola, and I also add color to the nipple to make everything really blend seamlessly. But if it's a flat breast mound and I do a 3D nipple tattoo, what I do is match the color palette to their skin tone and have them take a look in the mirror, make sure that they're comfortable with the new color and the shape and the size before I do the tattooing.
Okay, cool. Um, so can you also talk a little bit about scar camouflage, what that means, who's a candidate, like sort of why you would consider that,
Sure.
and what you do?
Sure. So scar camouflage is a type of tattoo, and it's primarily used over scars that are white. So they're old enough where they've kind of gone through that post inflammatory hyperpigmentation stage, and now they're white and they can be tattooed to blend in with the patient's skin tone. A lot of times people need some extra services like microneedling in order to help to bring it just to help aid the healing process to get it to that point where it's light enough to do a scar camouflage tattoo. But oftentimes, a couple sessions of microneedling will do the trick to help minimize the appearance of the scar and make it a little flatter.
Okay, and at what point do patients typically consider that? Like, how long do you wait after surgery to say, hey, this is still too pink, I could use some microneedling camouflage,
So,
etc.
microneedling can be done about 6 to 8 weeks after the surgery on
Okay,
a
wow.
scar.
So
For
that's quick.
Yeah, there's actually a link in my bio that talks about microneedling and the benefits of microneedling and the timing on that and who it really can be helpful for. Um, then for the nipple tattoos, I typically wait 4 to 6 months after the patient's last surgery to make sure they're completely healed before doing the tattoos.
Okay. And just to clarify, by last surgery, you mean even small revision procedures count,
I
right?
prefer to have them done when everybody's completely finished because then they're also mentally ready to have the
Right.
tattoos at that time. And I know that sometimes small adjustments need to be made, like some fat grafting and whatnot. But it's, in my opinion, best to just to wait until you're completely done with the surgery to have the tattoos.
Okay. So, Xandra, can you talk about your timing and experience? Did you choose not to have nipple reconstruction, or was that sort of contraindicated for you? What made you do the 3D tattoos? All that good stuff.
So I did not I did not understand initially when I first got my diagnosis. I found out that my cancer was actually in the cells of the nipple. I had a rare type of breast cancer called Paget's disease. So there was no mass, no tumor. So the first thing to go was definitely going to be the nipple because that's and the areola because that's where my cancer was. So I didn't have a choice. And when I initially got the double mastectomy, we weren't able to spare the nipples. Obviously, I didn't really know what my options were. I wish that I had like more resources available to me back then. It was in 2020 and I had a delayed diagnosis. And so when I initially was told about the process, it wasn't clear whether or not I would be a candidate for the nipple reconstruction. I wasn't even really sure exactly what that meant or entailed at first, but I was hoping I would be able to get the nipple reconstruction because I wanted to have I wanted to be more than just a three-dimensional tattoo. I was really hoping that I could feel as whole as possible after the reconstruction. But what I found out is that for people who have very thin skin, they're not a candidate for the nipple reconstruction. You take the skin from different areas of the body. I know usually it's the stomach, like a tummy tuck, and then they would have to bunch the skin together and create a nipple. But the skin around the breast has to be strong enough to hold it.
Right.
And mine is so thin, like you could see my veins. So it wasn't a choice. I was disappointed at first. And so I didn't think I was going to get the nipple tattoos initially. I was really, it was emotionally tough finding out that I wasn't a candidate for the reconstruction. And I really didn't know how I felt about getting, as in essence, nipples just painted onto me. I didn't know if it would be good enough. So I had considered just living without anything there. My scar runs horizontal directly across both breasts. I avoided the mirror for a really long time. It was the hardest part. Like losing my breast wasn't that hard because I knew implants would take the place of them. But losing my nipples was definitely, I still cope, you know. And so then Dr. Israeli, who was my plastic surgeon, he he was the one who really pushed me to consider the nipple tattoo. And most of my apprehension was not really knowing much about it and not having any patients who had been through it before to speak to and to see pictures. And he introduced me to Marnie, and it's honestly I just wish I had done it sooner.
So, can I ask how long you waited to do it?
Yes, my double mastectomy was in November 2020. I ended up getting the tattoos about a year and a half after my surgery.
Okay.
And the only reason that I waited so long is just because I had some complications from my double mastectomy. I'm prone to infections. So I got an infection, which led to a subsequent surgery. I needed a new pair of implants. And then I got another infection and, and then my implants flipped over.
Oh my God.
And so we really needed to be careful that we, like Marnie says, usually you wait like 4 to 6 months. And
Right.
that's the last big surgery because you don't want the doctor having to open you up in this area again once you've had the tattoos
Right.
or even because it might be uneven. So
Yeah, that is another good point when thinking about getting the 3D tattoo. Not only, is it a matter of healing and, worrying about things like infection and blood flow to the area, it is also something that then can be disrupted by additional surgery afterwards. But it sounds like you were pretty well convinced to do this when you were in the process of your early stages of reconstruction, and that delay wasn't as much because of the sort of emotional stuff that you were talking about before as it was logistics issues, or did they kind of go hand in hand?
so it At first, it was up in the air whether or not I was going to be able to get the nipple reconstruction. So I didn't wake up from my double mastectomy and then get that news. No, you're not a
Right.
candidate. I was told you really have to heal, and then we'll see how strong your skin is after healing. But what happened is it took a while for me to find out because I did have 3 surgeries year to keep tweaking it and fixing problems that I had, and each time he had to keep going into the scar and taking away more skin. So once I finally found out, I would say I then it was about a year that I was living with my breasts just with the scar, no nipples, no tattoos, that I was really scared. I was afraid. I didn't know if it would hurt. I didn't know if it would make me more sad to like
Yeah.
see it from the side without the depth of them protruding.
So,
About a year.
so how is that like, how does that feel now that you did it? Like, are you still coping? Do you feel how's it going emotionally?
I am so happy that I got the nipple tattoos. I didn't expect to feel the way that I do. It was like relief. As soon as we finished the first session, I remember looking in the mirror and I got really emotional in a good way because they look so real. And I didn't expect them to look that real. They look so good that they look better than my original nipples did. So that was something I ended up like being really excited about. I'm like, oh my gosh, she matched the color like perfectly to my skin tone. And I love the way that they look emotionally. Like it's still, I still have my days where I can't believe it. Like I said, I have the implants and it's a faux boob, but
Right.
they look awesome and they look better than real ones do, really. She does such an amazing job, but it's mind blowing that I lost such a big part of me, and just being a woman, it's a body part, it's an amputation. So still every once in a while I do get emotional about that loss. I think I always will, but this helps me to feel so much more complete. I look in the mirror now and I smile, and because they look good. And before I avoided the mirror at all costs because not seeing anything there, it really got me down.
Right.
Shocking.
I mean, it does make sense. A lot of what we talk about with breastreconstruction.org is how that physical restoration can really, help you restore yourself emotionally and rebuild your life and not move on, but carry on with this information and sort of have your diagnosis be less of a daily thing that you're thinking about. So it's wonderful to hear that you had this experience. It sounds like you were a complicated case in terms of the infection. Marnie, can you talk about how you approach cases like Sandra? Is there anything that you do differently? What sorts of safety and sanitary procedures are in place, particularly for patients who are prone to
Well, they're
infection?
all prone to infection, and I'm bloodborne pathogen certified and trained, and all of this is part of being a tattoo artist and my licensure requirements, which they vary state by state. But in New York City, it's by the Department of Health and Human Services, or in New York, it's by the Department of Health and Human Services. So I'm licensed in Nassau County. You have to be licensed in the counties that you practice in here. So I'm licensed in Nassau County and in New York City. But the protocols are the same for each patient. The room is sterile, the needles are sterile, the equipment is sterile. Um, so everything is very safe. A lot of times people do want to bring somebody into the room for support, which I appreciate, but I try to make it so they can at least, they can't come in the room when I'm tattooing, but they can sit in an area that's far enough away that's not going to cause any problems. And it's really for safety. It's not because I don't want the support person to be there, but it's for safety reasons. And I try to explain that the best way I can to the family members that want to come into the tattoo room. And you know what Xandra said about having multiple surgeries, it's pretty common, and a lot of people don't understand that they might have to have multiple surgeries. I myself had 5 surgeries. So the most recent one was in December, going from under the muscle to over the muscle on one side. So I understand that you may think that you might be done and ready for the tattoos, but things come up. So you know, even if they do come up down the road, hopefully it's not something where it's major enough where they'll have to go through the tattoo. But if they do, if the surgeon does have to go through the tattoo, I most of the time can make some adjustments to even things out and make it appear like a 3D nipple tattoo again.
Okay. I do want to go back to something that you said, Sandra, that I wasn't totally sure that everybody's going to be familiar with what you meant. You said you had a delayed diagnosis. What did that mean for you?
Yes. So about 2.5 years went by where I was symptomatic and seeing various doctors because I knew something was wrong. There were changes in my nipples that had progressed over a 2.5 year period, and I was misdiagnosed. I was dismissed. I had to really do my own research, and I kept seeing doctor after doctor. And, just to explain it a little bit more, the type of cancer, I had 2 types of cancer. DCIS, a lot of people are familiar with. That's ductal
Ductal carcinoma in situ.
so that one's more common. But Paget's disease of the nipple, it's in the cells of the nipple. So it's one of the only types of breast cancer that can't be identified through a mammo or an ultrasound because there is no mammo. And
Right.
so to just do a needle biopsy isn't possible because typically a needle biopsy is done when there's a mass with some kind of fluid inside of it. But there's nothing to target. You just start to notice changes in the nipple that can and the nipple that can resemble eczema or like chafing from working out. So my nipple started to change colors. It started to become a little bit inflamed, irritated, became more red, darker over time. My areola, the Montgomery gland, started to get more swollen and bigger. The areola started to grow bigger. So this was very gradual. I had a mammo done 2 years in a row. It was totally clear, negative, unremarkable. So even though the changes kept progressing, the doctors said no one knew about Paget's, or if they did, they thought that it was too rare, that it wasn't worth doing the only test that can be done to diagnose it, which is to cut the nipple. You have to actually and send it off for pathology, and it leaves a big scar, more than a scar. It deforms you. And so most doctors don't know enough. They're not confident enough to say, yes, I have a 33-year-old girl. It's worth it for me to cause this kind of deformity. Most doctors are going to just say, let's put antibiotic creams on it and hope it goes away because it's so rare. It's less than 2% of all breast cancer. So I've been trying to raise awareness because not only for the women who experience the changes, but even for the doctors, just to know, like, you may have learned about it in school, read about it in a textbook, but there are so many women who are young being on Instagram raising awareness. There's been, the youngest person I spoke to who was diagnosed was 14. She was in one of the Latina, a lot of women in their 20s and 30s. And a lot of times I know that women say they start to experience the symptoms after breastfeeding. So often the doctors will also think that your breast changed or that it's an infection like in the ducts or in the breast from breastfeeding. So it's very easy to diagnose. And the first treatment for it is removal of the nipple and the areola.
Okay.
Yeah.
And then you go to Marnie and you have her create something new. At this point, I do want to just say to anybody who's watching that we are taking your questions. So if anybody has anything they would like to ask, please feel free to throw it in the
It
chat.
looks like there's
And
a
if not,
question. about the pain of a nipple tattoo. Does it hurt? And what is the aftercare?
So if you
Zero pain.
want to answer that, zero pain.
So I never had any tattoo before this, right? So I didn't have anything to compare it to, but I was always under the assumption, well, actually, I think it's true that tattoos can be painful. Um, so that was one of the reasons I was nervous, is because that whole area had been through so much already. And I had been through so many painful surgeries and recoveries. I just didn't want to go through like yet another painful procedure. But what I didn't know when I was first diagnosed with cancer and found out I would need a mastectomy is that after a double mastectomy, because they have to cut through all the nerves, there's so many nerve endings running through the breast, and they remove all of the fat, all of the breast tissue. And in doing that, they damage all of the nerves there. So most people, if not all people, are going to lose all sensation, all feeling in the breast. So it's been almost 4 years since my double mastectomy, and I have absolutely no feeling on the skin. So I can't feel the needle from the tattooing. So it's zero discomfort, zero pain.
And then some people, everybody's different. Some people do have a little bit of sensation. And if they do, I regardless work prophylactically with a topical anesthetic that takes away any sort of discomfort or feeling that they might have.
Okay. We have some questions about what the recovery is like afterwards, sort of like what is the aftercare after a tattoo?
Okay, so after the tattoo is finished, I apply Tegaderm, which is a clear adhesive bandage over the tattoo. And that'll stay on for 3 to 5 days, after which you'll just gently remove it in the shower, clean away any fluid that may have accumulated under the Tegaderm, and then apply an aftercare lotion that has grapeseed oil in it that'll just help the tattoo heal a little more quickly. There might be some flaking and peeling, which is completely normal, and it might look a little red and bright initially afterwards, but the color will like soften and settle down during the healing process over the following couple of weeks.
Okay.
If
And now you
somebody's
mentioned,
allergic, let me
yeah,
just say that there
go
are a
ahead.
lot of people that are allergic to Tegaderm, and in that case, I apply Hypofix, which is a soft sort of gauze tape, but that it's not
Okay.
waterproof. So the Tegaderm's waterproof, and you can shower with it, and it'll protect your sheets and your clothing, and to just keep the fluids, inside of the Tegaderm from getting all over everything. But the Hypofix, you've got to change it every day.
Okay. And you mentioned when the tattoo is done, how many sessions are typical?
So typically it's 2 sessions. The second session is 8 weeks after the first session, but we may have to do a touch up down the road, like a year later, or 2 years later, because there could have been an additional surgery or procedure, and then somebody may have more scarring or stretch marks than somebody else, and there might be some uneven fading in certain areas. So we're always happy to do some little touch ups as needed. Just like if you have reconstructive surgery, you might have to have a minor revision, and it's the same with the tattoos. There may have to be a touch up that's done down the road.
Okay. So we are entering our final couple of minutes. I do want to answer a handful of questions that I jotted down while you were talking. One of which is, are there specific concerns for people who've had radiation? Is that contraindicated with tattooing?
So no, they can definitely get tattoos. The only difference is that I modify my pigment a little bit on the radiated side, so the color doesn't turn like a gray color. So I just add a modifier to the radiated side to make them look even when the tattoo's healed.
Okay. And we had another question about scar camouflage and whether someone with a raised scar is a candidate for any type of camouflage.
I would recommend microneedlings first
Okay.
to flatten the scar, and just wait until it gets a little flatter and lighter before doing the scar camouflage. And I also, going back to the radiated skin question,
Mhm.
it's a little more involved than that, because I also use a different needle configuration, because the radiated skin is typically a lot tougher than the other side, the non-radiated side. So there are different, approaches that I take to each breast. that will make them look even in the long run.
Okay. Another question we had that I'm going to sort of broaden from what this person asked is just about other types of therapies that are not surgical that you might be having, and how they interact with your candidacy for nipple tattoos. So if you're having some sort of additional adjuvant therapy that is not surgical, do you need to be finished with that before you can have a tattoo, or how does that work?
Well, it depends on what it is. As long as they're not, doing anything to the breast mound or the area that's been tattooed, you should be perfectly fine to continue with your physical therapy.
Or like I mean more like not like chemotherapy, immunotherapy. Somebody asked a question about targeted white
okay.
blood
I
cell
thought you meant like
treatment.
physical therapy.
No, like
okay.
adjuvant pharmaceutical
Okay, so
intervention.
the 10-hour drive is catching up with me. Yeah, I prefer they are completely finished with chemo and radiation before they get their tattoos.
And okay, and anything else they might have going on.
Yes.
Okay. Well,
There's a question about a YouTube channel. I don't have a YouTube channel, but we are working on it. I don't know if you want to just briefly hint on this, Karina, but we will be doing some video for the breastreconstruction.org website that will take you through the nipple tattoo process.
Yeah. So breastreconstruction.org is building right now a pretty robust information resource for nipple tattooing. It's going to include videos of Marnie doing the procedure, a lot of before and after photos, breakdowns, sort of written out list essentially of some of what we've gone over here, of how the procedure works, of what the timing is like, etc. And I think, the time is now 8:00. I don't know, Marnie, Xandra, if you have anything else that you would like to share that you feel haven't been covered, or
as recovery process, I just want to add that it's really easy. Marnie gave me a little ointment and a tiny little tube. It looked similar to an Aquaphor ointment. So I just had to dab that on twice a day. Like I said, I'm numb. So there was no pain or tenderness that I could feel on that skin at all. It did flake just a little bit, but very, very minor. I'm sure it's different for everyone. But also one thing that I had learned that I remember I was worried about, you are supposed to avoid getting totally submerged in water, right? For about 2 weeks. And it also includes like profuse sweating. So I did try to schedule mine at a time when it wasn't summer, because I like to tan. I like running outside daily. And it's not that you can't sweat or go underwater, but it's the tattoo won't hold as good, because Marnie was really good at teaching me. And she said that when you sweat out the ink, right?
Well, sweat has saline in it, and saline essentially is what we use to remove tattoo pigment with.
Right.
So it can definitely cause the tattoo to fade a lot faster. If I do a tattoo and you go jump in the ocean, it's not going to heal right, and it's going to fade pretty quickly. So aftercare is a big part of the healing process and the way that your tattoos are going to look in the future. And I give you an aftercare sheet that outlines everything, because I know it's a lot to remember when I'm explaining the aftercare process and the what to do beforehand. So during your consultation, I'll give you before, like, pre-procedure instructions, what you need to do 7 days prior to, what medications you need to discontinue. You have to discontinue alcohol 24 hours prior to, no caffeine the morning of. So it's a pretty comprehensive list, of instructions. And yeah, I remember. And I was like, whoa, I'm taking that right now. But and then I'll give you an aftercare sheet in your aftercare kit, so you can refer to that if you have any questions or you can't remember what the process is.
I do, just because you're on aftercare, we had a question about whether any sort of topical anesthetic or anything that you do impacts the longevity of the tattoo.
No, it's meant for tattooing. It's a tattoo ointment.
Not going to jeopardize your own handiwork.
Well, so when you're tattooing, it does tend to dry out the skin. So it's helpful to have that ointment anyway while you're tattooing to add the moisture back to the skin, and it just helps the longevity of the tattoo. So it's a good thing.
Okay. There is one more question that has not come up here, but that I meant to cover earlier. Can you just talk a little bit about the difference between like a restorative tattoo artist and body art tattooing, and like sort of what the distinction is there? Because what you do is very, very specific. There are some body art tattooists who will do nipples, but wondering if you could share a little bit on what the difference is there.
Yeah, I mean, the body art tattoos are, they're beautiful, they're vibrant in color, and they're typically intricate designs or, whatever the client works with their artist to create. The nipple tattoos or restorative tattoos, and the body art tattoos typically aren't on compromised skin, whereas the restorative tattoos are on compromised skin that's been operated on, that may have stretch marks that have been transferred from the abdomen to the breast, and have scarring, and they're meant to be a lighter and softer sort of color and look more natural. So it just some people who've had mastectomies, they prefer to have a body art, a beautiful, floral piece of art across their chest, and some people prefer to have nipple tattoos. So, it's important to research your artist regardless and look at all of your options and determine who's right for you and what's going to make you more comfortable with after you've gone through, the whole experience of having breast cancer, your treatment and recovery.
Add to that from like the patient perspective, I do have two people who I've met along the way, who also are breast cancer survivors and both of them had their tattoos done at tattoo parlors, their nipple tattoos. And they saw, I share my stories, and Marnie and Dr. Israeli have also shared before and after photos of me and little video clips. And I know that two women in particular have ended up sharing theirs with me, and it lacks that like that authentic look to it. Like the 3D element is not as good. And also, I know that they paid 100% out of pocket when they went to tattoo parlors. And that's a question that I get a lot, is about how much it cost. And I went through my doctor's office. Marnie is affiliated with the surgeon. So she's actually got her own space in the same building. So we were able to, it was really nice, like collaborate. My surgeon was there with Marnie to measure and see exactly where to place them from a plastic surgeon's perspective as well. So I had two different types of artists there in the room. I had an artist who does the tattoo, and I had the artist who made my breasts. So I feel very blessed. And then the perk was that it went through health insurance for me.
Right.
Well, I knew who went to the tattoo parlor. That's not an option when you're going to a private tattoo parlor.
And I focus on nipple tattoos, so that's all I do all day long. And I work really hard to try to make them look as natural and realistic as possible. And what they do is something different all day long. So, it's just a different type of artist as well.
Yeah, for sure. And, I do think that there is something to be said for seeing somebody who is not only steeped in this and can potentially get it covered by insurance, but who also is able to offer, microneedling, scar camouflage. If you're like looking to do multiple things, it does seem like a really good option for some people. We are now like 5 or 10 minutes past when we were supposed to wrap it up. I want to say that, you can check Marnie's Instagram out. She's got lots of nipple pictures and is fighting the good fight to keep them available online. And you can also check out some of her work. Yeah. You'll be able to check out her work at breastreconstruction.org. Shameless plug. If you're following Marnie or Xandra and you joined, please follow us. If this was helpful, if you want more information about your breast reconstruction options. And I think that is all. Thank you so much for your time, guys.
Thank you. And I just want to say, if anybody has any questions that they didn't get answered, just to feel free to DM, any of us, and we're happy to help.
For sure. Yeah, absolutely. Thanks so much, guys.
All
Have a
right.
great night.
Thank you.
Yeah.